Hypertension, commonly known as high blood pressure, is a major risk factor for heart disease and stroke. The most common causes of hypertension include lifestyle factors such as diet, lack of physical activity, obesity, excessive alcohol consumption, and chronic stress, as well as underlying conditions like kidney disease, hormonal disorders, or a family history of high blood pressure. This video explains the chain reaction that leads from hypertension to serious cardiovascular issues and focuses on the role of diet in this process and how you can reduce your risks through lifestyle changes and medical tests. The glycocalyx is a protective gel-like layer lining the insides of your blood vessels. It helps maintain smooth blood flow and protects the vessel walls. Additionally, a healthy glycocalyx lining supports the release of nitric oxide, a molecule essential for relaxing blood vessels and regulating blood pressure. High carbohydrate diets, particularly those rich in refined sugars, can damage this layer by increasing blood sugar levels. Over time, this damage weakens the glycocalyx, making blood vessels more prone to injury and inflammation. When the glycocalyx is damaged, nitric oxide production decreases, leading to increased vascular stiffness. As well, blood flow resistance increases. These changes lead to higher blood pressure or hypertension, which puts additional strain on the heart and blood vessels. Hypertension causes turbulent blood flow, which creates stress on the vessel walls. This stress leads to microscopic tears and damage. The body responds by sending LDL or low-density lipoprotein cholesterol carriers to repair these tears. Over time, this process creates hard plaques in the arteries, narrowing them and reducing blood flow. These hard plaques are essentially scabs on the insides of the blood vessel walls. Importantly, plaques do not form diffusely along all blood vessel walls, but instead occur at specific zones where arteries divide and turbulent blood flow is greatest. This indicates that atherosclerosis results from direct trauma to the vessel walls rather than simply high concentrations of cholesterol. Before moving forward, it is important to understand the role of cholesterol and triglycerides. They often get a bad reputation, but they are far more than just numbers on a lab report. They are essential for many of the body's functions, such as supporting brain health, strengthening the immune system, maintaining healthy cells, and producing energy. Also, when discussing cholesterol and heart health, it is crucial to understand what cholesterol tests actually measure and why terms like bad cholesterol are outdated. Dietary fat consists of fatty acids and cholesterol, which serve different roles in the body. Fatty acids are primarily stored and transported in groups of 3, forming triglycerides, which are the body's main source of energy storage and fuel. Cholesterol, on the other hand, is not used for energy, but is essential for building cell membranes, hormones like estrogen and testosterone, and bile acids needed for digestion. Additionally, cholesterol is used by the body to produce vitamin D when the skin is exposed to sunlight. Chylomicrons, a type of lipoprotein, carry dietary fat from the intestines through the bloodstream to various tissues. Meanwhile, VLDL, or very low-density lipoprotein, and LDL, or low-density lipoprotein, transport cholesterol and triglycerides between the liver and body tissues. While triglycerides provide energy, cholesterol supports structural and hormonal functions, and all these fats are carried in the bloodstream by different lipoproteins to where they are needed. When you get a cholesterol test, it doesn't truly measure cholesterol itself. Instead, it measures lipoproteins, the carriers that transport cholesterol and triglycerides through your bloodstream. These carriers are necessary because cholesterol and triglycerides do not dissolve in blood. Think of lipoproteins as vehicles that shuttle cholesterol and triglycerides to where they're needed in your body. Traditionally, LDL had been labeled bad cholesterol and HDL, or high-density lipoprotein, as good cholesterol. However, this oversimplified the story, and the term bad cholesterol is no longer used. LDL itself is not inherently bad. It's essential for delivering both the building blocks, cholesterol, and the energy storage product, triglycerides, to your cells. Problems arise when LDL is damaged, creating a subtype of LDL which can become harmful. Not all LDL particles are the same. They vary in size and density. Large, buoyant LDL particles are generally not harmful and less likely to contribute to heart disease. On the other hand, small, dense LDL, or SDLDL, is more concerning. These smaller and denser particles are more likely to penetrate the walls of blood vessels, where they can become further damaged and trigger inflammation. This process contributes to the development of atherosclerosis, which is plaque buildup in arteries, and increases the risk of heart disease. Advanced cholesterol tests can measure the levels and subtypes of LDL in your blood, providing a clearer picture of your cardiovascular risk than standard tests. When these advanced tests are not available, the LDL-ApoB ratio can be used instead as an indirect approximation of the volume of SDLDL. Dietary fat, such as cholesterol and triglycerides, is not directly transported from the intestines to the liver. Dietary carbohydrates, on the other hand, are first broken down into sugar in the intestines and then directly transported to the liver via the bloodstream. Once there, they are converted into fatty acids and then to triglycerides. The triglycerides are then packaged, along with cholesterol, into carriers called VLDL. These VLDL particles transport triglycerides to the body's fat tissues and also, through a special exchange process, can transfer them to LDL. This transfer process makes the LDL triglyceride rich, which then causes it to break down into SDLDL. The greater the amount of VLDL required to package the excessive volumes of triglycerides, the greater the amount of SDLDL that is created from healthy LDL. When SDLDL penetrates the vessel walls, it becomes prone to further modification. If exposed to seed oils, it can be damaged by a process called oxidation. If exposed to high blood sugar, it can be damaged by a process called glycation. Both types of damage lead to inflammation and then the formation of a soft plaque, which is a collection of pus and inflammatory tissue. These soft plaques form alongside the hard plaques and are highly unstable. Hard plaques, think of them like a scab, are stable deposits that build up over time. They cause the arteries to narrow, a condition called stenosis, reducing blood flow to the heart muscle, especially during physical exertion when your heart needs more oxygen. This reduced blood flow can lead to chest pain or discomfort known as angina. Angina is typically triggered by activities like exercise or climbing stairs and usually subsides with rest. Soft plaques, think of a pustule, on the other hand, are unstable. These plaques have a thinner, more fragile outer layer that can rupture without warning. When a soft plaque ruptures, it exposes its contents to the bloodstream, triggering the formation of a blood clot. This clot can quickly block the artery, completely cutting off blood flow to the heart muscle and/or brain. Unlike hard plaques, soft plaque rupture can cause a heart attack, myocardial infarction or stroke, cerebrovascular accident, even at rest or during minimal activity. To assess your risk of heart disease and stroke, consider the following tests. 1. Blood pressure monitoring. Regularly check your blood pressure at home to ensure it remains within a healthy range, below 120 over 80 millimeters of mercury. 2. Glucose tolerance test. This test evaluates how your body processes sugar, identifying early signs of insulin resistance or diabetes. 3. Advanced cholesterol tests. These tests directly detect the presence of small, dense LDL, providing insights into your cardiovascular risk. These tests are not readily available. 4. LDL-ApoB ratio test. This test indirectly estimates the volume of small, dense LDL. A number higher than 1.2 is considered good and lower is bad. This test is readily available. 5. Stress test. This test determines whether hard plaques are causing angina, chest pain, by assessing blood flow to the heart during physical exertion. 6. Connecticut coronary artery scan. This imaging test detects hard and soft plaques, helping to identify unstable areas at risk of rupture. The good news is that you can lower your risk of heart disease and stroke through simple yet effective lifestyle changes. 1. Exercise regularly. Aim for at least 150 minutes of moderate aerobic activity per week. Exercise helps improve blood pressure, blood sugar levels, and overall cardiovascular health. A relaxed walk will burn fat but spare muscle. Simply 10,000 steps, 5 miles daily for 1 week will burn the caloric equivalent of 1 pound of fat. 2. Limit seed oil consumption. Opt for healthier fats such as beef tallow, lard, olive oil or avocado oil to minimize oxidative stress and prevent damage to small, dense LDL. 3. Adopt a low-carbohydrate diet. Reduce your intake of carbohydrates and free sugars to protect the glycocalyx, thus maintaining a healthy blood pressure, limit triglyceride production and thus small, dense LDL production, and prevent damage to small, dense LDL. 4. Strive to keep your blood pressure normal, whether through the above strategies or medication, meditation, interpersonal interactions, entertainment, etc. Remember, the main driver of atherosclerosis is the mechanical trauma caused by hypertension. 5. Monitor your health. Use the tests listed above to stay proactive. Understanding how hypertension, diet, and lifestyle choices interact is the first step in preventing heart disease and stroke. By making informed decisions about your diet, exercise, and medical monitoring, you can protect your heart and enjoy a healthier life.